Coffin-Lowry syndrome, or CLS, is a condition that causes mental retardation as well as abnormalities in the cardiovascular system and skeletal development. CLS is caused by a mutation in the RPS6Ka3 gene. This is responsible for providing instructions for producing proteins in which are necessary in regulating the activity of other genes, as well as involvement in the signaling with cell pathways in the brain. Also, the protein provided by the RPS6Ka3 gene is vital to the formation of long-term memory and survival of nerve cells, which is why when altered, mental ability is severely weakened. There have been over 125 various mutations in the gene that have been linked to cause CLS. The mutation is inherited through the X-linked dominant pattern, meaning it is passed on by the paternal side, or mother. Due to the location of the gene on the X chromosome, it makes the disease more prominent in males. As a condition that is inherited, the onset usually occurs at the postnatal stage, or point beginning after birth, and continues throughout a person's entire lifespan. Symptoms of CLS consist of severe mental retardation and facial deformities such as enlarged forehead, widely spaced eyes, full lips, and wide mouth. Hands will often have tapered fingers, and in children a simian crease will be found. Microcephalic head, which is a head with abnormally small circumference, is normal in those with CLS. Also abnormal curvature in the spine is extremely common, which causes a short stature. Cardiovascular complications along with frequent drop episodes have been found in many cases. Currently, scientists are still working on a cure and have yet to find a suitable process of correcting the mutated gene. Treatment so far has been limited to symptomatic procedures. These include physical therapy to increase mobility, speech therapy, and special educational services. In cases where drop episodes are frequent, valproate will often be prescribed. In the human element of things, attempting to have a normal life is extremely difficult in those with Coffin-Lowry syndrome. As far as short-term effects, the ability to communicate and build relationships becomes extremely harder, and mobility is greatly reduced, as well as constant health complications. Through the long term, the lack of an independent and fulfilling life plagues many due to dependence of others for care. Also, reduced lifespan and development of depression may occur. Like many health complications, living costs are exponentially higher with those living with CLS. Costs mainly originate from doctor visits, physical therapists, home care such as nurses, drug costs, and the list may go on. The annual cost for someone with CLS may add up to or surpass $70,000 per year. Diagnosis of Coffin-Lowry syndrome consists of mainly examining for physical abnormalities commonly found in patients with CLS, as well as a molecular genetics test of the RPS-Ka3 gene, which is done through sequence analysis. For early diagnosis, doctors will often search for a simian crease in the hand of an infant, which will often provide a general sign of CLS or a different type of medical condition. When examining the statistics of CLS, the condition is classified as rare. The risk factor has been calculated to be 1 out of 50,000. As far as the amount of people with CLS, roughly 19,040 people have been currently diagnosed in the U.S., which is 1/100% of Americans. Here we have a 6-year-old boy named Ben. As you can tell from Ben's facial features, he has been diagnosed with Coffin-Lowry syndrome. Aside from his intellectual disabilities, he also struggles to walk normally and has occasional drop episodes. A relatively effective treatment plan for someone diagnosed at a young age would consist of intense physical and speech therapy, roughly 3 times a week, daily special education, corrective spinal surgery when of age, meaning when the child is done growing, bi-monthly doctor visits, and minimal dose of valproate to help correct the drop episodes. Please, if you have any questions, please Google Coffin-Lowry syndrome.